Professor Zöllner, thank you very much for giving us an insight into the digital process chain in your practice today. Could you tell us a few words about yourself, your practice and your career?
Sure, of course. I've started at the university. In 2007, I set up a practice with my practice partner, and we started in a very small office, just the two of us, and a maximum of 10 employees. Now we are approximately 6 practitioners, 30 employees, 1 master dental technician and 2 more certified dental technicians.
Could you estimate, in terms of your entire practice workflow, approximately what percentage of your dental prosthetics work is done digitally?
Yes, of course. So for fixed dental prosthesis, we are 100% digital. One way to go. As for removable prosthesis or complete dentures, we are on the path. We are still more entrenched in the analog world there.
Was that the case right from the beginning in your practice?
No, due to age. And because we had processes in place that allowed us to reliably and very well solve prosthetic procedures, but actually through the change of material. So with the introduction of zirconia, the world in the laboratory changed. Suddenly, the digital world was not only there, it was indispensable. And so it was a logical consequence that we caught up in the practice.
And how long have you been working digitally in your practice in this form?
We've had always points of contact, and now we're essentially talking about digital impression taking. We've tested it occasionally, but it was never practical for us to use it as an everyday alternative to analog impressions until about 2 to 3 years ago.
That was specifically regarding the impression-taking process. How does it look then during the construction and manufacture of the dental prosthesis?
That's an interesting question. You see, because the path has reversed. Initially, we came from the laboratory and we caught up. Now we generate the data, and for the first time we can consider what to do with the data. So it's very important to consider computer-aided design suddenly becomes computer-aided decision-making. Which data do I perhaps keep? Which do I process further? And perhaps which dental prosthesis do I manufacture in the practice or in the practice laboratory itself?
Could you summarize your experiences with the digital process chain in one sentence?
Yes, of course. It's challenging. It's wonderful. And it's a path one enjoys progressing on, even if it may be challenging in the details at times.
And based on your experience, what advice would you give to other practices?
I would strongly advise you to think big right from the start. That means considering the entire digital solution chain, but perhaps starting small. Think about what you want to begin with. Partial crowns, single crowns. You will quickly realize that this journey is fascinating. And one should not limit it by initially thinking too small.
Thank you for the conversation.